There's an old saying, a picture is worth 1,000 words. Well, think about the pictures these numbers conjure up. Our healthcare system is incredibly broken, and it has been for quite some time, decades actually. We're now waiting nearly 20 days to get an appointment with our primary care physician. And once we're there for 2 hours. And of those 2 hours, only about 8 minutes are spent in the presence of our PCP. So access to our system is broken, and the quality of our experience is anything but high, or for that matter, acceptable. Unfortunately, this is our reality, and it's been on a downward slope for the last 25 years. To make matters worse, the cost of the care is high and going higher at a pace that's not only unacceptable, but also unsustainable. The average cost for an emergency room visit already exceeds $1,300, and the average cost for a PCP or urgent care visit is $150. But here's the real catch. We are so conditioned, and have been for years now, as consumers of healthcare, we run off to our doctor's office, or more recently, urgent care centers and hospital emergency rooms, whenever we feel as though we need the care of a doctor. And in almost 3/4 of the cases, the visit to the ER wasn't even necessary. Let me repeat that. In nearly 3/4 of those cases, the visit wasn't necessary, and the bill for that visit was, on average, more than $1,300. Over the span of the last 10 years or so, we've had some incredible examples of innovative companies disrupting segments of our domestic and our global economy that on the surface didn't necessarily appear as though it was ripe for change or disruption. Think of this. Until only 7 or 8 years ago, when you needed to hail a cab, you stepped off a curb and threw your arm in the air. And if you were lucky and it was the right time of day, a cab pulled over and you jumped in and off you went. Well, along came Uber, and together with technology and an innovative app, you can now tap a button and get a car to come to where you are, when you need it, and take you where you want to go. No need to exchange money. Your credit card is already pre-programmed in the app. It took Uber nearly 6.5 years to hit the 1 billion ride mark, and another 6 months to double that to 2 billion. And Uber's estimated value is north of $60 billion, and they don't even own any vehicles. Similarly, disruptive players have emerged on the social media front with the likes of Facebook and Twitter and Instagram, on the retail front with Alibaba and Amazon, and in the lodging arena with Airbnb. All of these innovators saw a need for disruptive change in everyday areas of our lives. What could be more everyday than hailing a cab or communicating with friends and coworkers or buying goods in a retail setting or securing overnight accommodations? Well, let me ask you this. What could be more everyday with the notion of disrupting how we go about accessing high-quality healthcare at a cost that we can afford, not only today, but tomorrow and 6 months from now and a year or more from now? Would that be disruptive? How about the timing? Would that be needed? Global Rescue, like some of these other disruptive examples, has simply said, enough is enough, and there has to be a better way to access high-quality healthcare, all the while at a price that is affordable. Like these other disruptive examples, the market demand and need for change in healthcare is ripe, and the technology is available to change the paradigm in a significant way. We call our solution TotalCare. It's a virtual healthcare service that provides access to paramedics, nurses, and physicians for urgent consults 24 hours a day, 7 days a week, every day of the year. Wherever you are, whenever you need us, we'll be there for you. No more 20-day wait time for your appointment. No more 2+ hours in your PCP office, when you're really only in front of your PCP for an average of 8 minutes. And through our partnership arrangements with Elite Medical Group, Johns Hopkins Medicine Division of Special Operations, and Partners Healthcare, we've assembled a world-class array of medical professionals that are prepared to handle the gamut from routine to complex, even if that should include specialty consultations, second opinions, prescriptions, labs, or imaging. So as our service's name suggests, we are bringing you total care, when you want it, when you need it, wherever you are. So let's take a look at some more numbers and try to put this value proposition around the virtues of a virtual healthcare visit in perspective. A typical family of 4 encounters 12 PCP or urgent care visits in any given year, and 2 additional emergency room visits. At $150 per PCP or urgent care visit, and more than $1,300 on average for an emergency room visit, that's over $4,400 paid by that family. Those are costs that are likely not covered by the family's health insurance plan. Why? Well, the average Silver Plan annual deductible, and that's the Silver Plan from the Affordable Care Act, is $6,000 or higher. So all of that care for 12 PCP or urgent care visits and 2 additional ER visits won't even hit the deductible of the health insurance plan. Alternatively, if that same family of 4 were Total Care members, a typical year for them might include 12 virtual consults with our medical professionals, no visits to the emergency room, and a few face-to-face visits to their PCP or urgent care center. This new reality, this new disruptive reality, would save that family of 4 over $3,000 that year. Further, families like this one can start to rethink their health insurance options, assuming they can recondition themselves to call our medical professionals first, rather than rush off to their PCP or urgent care center, or worse yet, the emergency room for things that could and should be handled virtually. Then they can also consider buying down to a lesser health insurance plan, a plan with higher deductibles and lower cost to them. Those savings will be above and beyond the actual savings realized by avoiding unnecessary care in an inappropriate setting. Plain and simple, this is the essence of disruptive technology at a time of incredible need. The overarching economic principles for a virtual healthcare solution like TotalCare apply to individuals and businesses alike. Let's face it, most Americans get their healthcare coverage through their employer. So if that family of 4 can save significant money by embracing TotalCare, so too can employers who are largely the ones that are sponsoring and paying the lion's share of the benefits cost. Let's look at some more numbers. These are equally shocking and compelling. Employers are spending, on average, more than $6,200 per year for an individual employee's healthcare coverage. The annual spend is almost 3 times that for families, more than $17,500. If that's not bad enough, in the last 15 years, employer healthcare costs have tripled. And finally, as the Affordable Care Act continues to demonstrate that it is anything but affordable, annual cost increases are regularly in the double digits, forcing employers to continue to push more cost and more burden down on their employees. Sadly, healthcare benefits today could be referred to as healthcare hassles. Regardless of whether an employer is a small, medium, or large employer, it's a safe assumption that they're struggling with their healthcare benefits. The TotalCare solution, appropriately adopted, will reduce unnecessary utilization in some of the most costly settings, like emergency rooms. Reduced utilization means reduced cost. Employers can buy less insurance, employees will have less exposure personally, yielding significant savings for both the employer and the employee. And the cost savings numbers add up quickly. Even for a company of only 200 employees, the annual cost savings begin to exceed $1 million. So the question becomes, do you want to be part of a solution to this broken $4 trillion healthcare system? All too often, and for far too many years now, the proverbial tail has been wagging the dog as it relates to our healthcare system. For the last 2 or 3 decades, we've been enduring a continuous degradation of our healthcare system. Regardless of whether we are an employer who provides healthcare benefits to our employees, an employee who gets healthcare coverage through our employer, or a dependent who relies on a healthcare benefit being offered to a spouse from their employer. Access is getting more and more convoluted. Quality has declined immensely, and the overall costs have skyrocketed. And the cost shift from employer to employee has been dramatic, all in an effort to maintain the ability to continue to offer some healthcare benefit. Enough is enough.